Thank you so much. And now the last presentation in this section will be by Ilona Tóth, physiotherapist in Budapest. Welcome, everyone. I'm a physiotherapist at STEPS Budapest, focusing on children. In my presentation, first I would like to talk about robotic rehabilitation in general, that I'm going to explain some of these devices, benefits, drawbacks, and then in the third part of my presentation, I'd like to speak about specific neuromuscular diagnoses. Now, what are robots? Robots are sensor-based mechatronic devices that are partly or fully capable of performing tasks involving complex movement or manipulation of objects. And they can be flexibly reprogrammed. Robotic therapy is mostly used in neurorehabilitation. When it comes to children, we use it in neuromuscular disorders, complex development disorders of the spinal injury, or in nervous system tumors, whereas in adults we use it after strokes, damage or injury to the spinal cord, brain, or the skull, sclerosis multiplex, or the nervous system. Now, neuroplasticity is the key to using robots in rehabilitation, because it helps change and it helps the nervous system to adapt. And it has a different impact when it comes to nerve damage. Robots have great benefits in rehabilitation, and the advantage is that they have high repetition numbers, precise movement patterns. You can regulate the level of difficulty quite well, fine-tune it. Target-oriented rehabilitation, there is a constant feedback, which patients tend to appreciate a lot. Using screen displays, they are motivated, and the greatest benefit is that they can have the experience, the sense of walking in a safe environment. Now, from a biomechanic point of view, you have end effector kinds, which are fixed to one point at the end of your limb, whereas exoskeletons cover an entire limb and it is fixed on several points. There are robots that we can employ on several parts of the body. There are ones that are specifically designed for lower or upper extremities. Now, Locomat is a device that allows body weight support. It has you can use it both with children and adults, because you can adjust the size as required. You can regulate, you can control speed, you can control the length of the step, and also the extent, the degree of body weight support. And this is controlled by the patient. And again, this is motivation both for adults and children. Lokomat, however, has several contraindications, including an age under 3 years, a femur shorter than 21 centimeters, lack of cooperation, hip dislocation, or with contractures or low bone density. These are all contraindications against Lokomat. Another end effector type robot is Perpedis, where we use a harness to provide dynamic body weight support, and its use requires an active bending and stretching of the knee, and this will allow you to improve stamina and knee control. Another device is an Undergo, which is a crossover between walking on a floor or on a treadmill. It also prevents falls, and it has multiple uses. Compared with Lokomat, a drawback is that we are less able to correct lower extremities. We can correct verbally or manually, and the use of this device requires a higher level of autonomy. The Armo Sping is already an exoskeleton which is fixed at 3 points, and by moving upper limbs, you can perform analytical and functional movements. And through the games, it's highly motivating both for children and adults. Amadeo is a device to improve fine motor skills. The magnets are fixed to the tips of the tongue. There are passive active or induced active movements. And through these fine motor movements, you can control a game. And it's also possible to carry out objective assessments of the condition of the fingers. Timo is a platform that improves balance, and it's quite effective in changing balance, shifting body weight laterally, back and forth, anterior and posterior directions. It can be used in a number of positions, standing up, on all fours, kneeling, etc. And you can practice and exercise. You can practice everyday practical situations. Pablo can be fixed to several parts of the body, and this device allows an endless number of opportunities to improve movement, movement coordination, balance, strengthening of muscles. And this is one of the devices that provides the greatest motivation for children. For example, if you have an exercise you would normally do in a gym, they can, exactly because you have a screen to give you visual display, there are certain exercises they shy away from doing in a gym because there is no feedback and they are out of their comfort zone. But if they try and practice using Pablo first and then move to the gym, they can overcome their fear. Let me emphasize that robotic therapy is not meant to replace traditional therapy, and you can expect the best results in a combination with. So very often traditional therapy plays a much more important role, and we are trying to be very clear about this when we talk to families, parents, and family members. Now let me move on to specific ideas to aspects to consider in the case of neuromuscular diseases. Now, we do not have very many studies on the effect of robotic therapy in using neuromuscular diagnosis. Using treadmills, aerobic training, verticalization, and suspension therapy is something where robotic therapy can have an improving effect and can make a difference in patients' conditions. There are a number of aspects that could limit. In SMA, medication was started after 4 or 5 years of age. We are faced with contractures or such deformities that can be a counterindication to using some of the devices or hip dislocations. And fatigue is something that comes in the picture with all diseases, and it's very important to adjust the load to the patient's needs and capabilities, which means that we need to weigh the health benefits, and then we will make a decision about robotic treatment together with parents and the treating doctor. And taking into consideration the general condition of the patient, we make a decision, and we do not recommend using more than 2 devices. No more than 2 should be used. And here, let me give you an idea about what treatment options we have. In SMA, the choice of device depends very much on whether or not the child receives medication and when it was started. If it was started before the age of 2, then we most of the time use the treadmill, the Locomat, which is combined with Timo or Pablo, a suspension tech improvement. Now, children where medication was started at a later age and they have a severe hip dislocation or severe contractures that are a counterindication to using Locomat, we focus on sitting positions and using a suspension system. We are trying to improve muscle strength in the therapy. Improving fine motor functions can be highly beneficial, but it's up to individual discretion. You need to consider the child individually, and that applies to all robotic devices. The greatest limitation is fatigue, the risk of fatigue and the risk of overloading, overburdening the child. So you need to be very careful, even though there are the benefits. Now, when it comes to DMD, a 9-year-old boy who's been visiting us since January, and he arrived to us after surgery, and when he arrived after 3 months after the operation, and could walk about 15 meters holding hands. And at a 50% suspension of the body weight, could walk 230 meters in 15 minutes. And now he could walk for 40 minutes with 3 little breaks, And the last time he walked over 700 meters with full body weight. And we request full feedback all the time from patients how tired how worn out they feel after therapy, because we do not want to trigger fatigue or overburden them. When they are unable to walk, we recommend Pablo and Timo, which can have spectacular results, that there is a movement they are unable to do in the gym. But if there is a playful feedback, there is visual feedback, they are much more keen on actually doing the exercises. With CMT, Locomat is step one, square one, which is combined with Timo, Pablo, and suspension training to increase core control. But because CMT is such a multifaceted condition, you always need to consider the individual's specific child, what they need and what condition they are in. And now let me give you sum up the results, the expectations you can have. You can improve stamina, improved balance, improved core control, have an increased distance, walking distance, and a better gait, improved gait. Also, in the case of neuromuscular therapy, secondary prevention is key in neuromuscular diseases like hip dislocations, scoliosis, and contractures. And also, one of the most beneficial effects is a positive psychological impact on the child or on anyone, both in children and adults, that you can actually experience walking and have the sense of walking again. Thank you very much for your attention, and let me show you a brief video about how we use Locomat. Thank you.
Köszönöm még egyszer a figyelmet.
Thank you so much for your attention again. Ms. Toth, thank you. And dear guests and colleagues, it's lunch coming up now, the lunch break. At the registration reception area, you can meet the puppies, support puppies. And if you want to find out about them, please join them. 3:10 is when we shall carry on.